Yo, what's up, everybody? Matty Willz tap back in for another fresh episode of Wellbeing Wednesday with Matty Willz. Of course, this is brought to you by MetroHealth, where each week we talk to a different representative of MetroHealth about various behavioral health situations, issues, overall health issues as well. This week we'll be focusing on Black Maternal Health Week, which is going on right now. So without further ado, we'll bring in Dr. Jessica Pippen, who is obviously a doctor with MetroHealth. So first and foremost, hi, how you doing? Thanks for joining us.
Thank you for having me. I am glad to be here to represent our department and division to talk about all the great things that we're doing to improve Black maternal health.
Absolutely, absolutely. As we mentioned, that week is going on right now. This year runs from April 11th through April 17th. Jessica, before we get started, I'd like the audience to know that we did not just yank you off the street and you about to start giving these people, really important information. So the accolades or the title that you have listed here is maternal fetal medicine physician and director of the Mother-Child Dependency Program and Antepartum, is that right? Services at MetroHealth. So do you want to elaborate on that a little bit? Just kind of talk about your journey at Metro?
Yeah, absolutely. So I'm a part of the high-risk OB division, which means that we take care of moms who have complex medical problems or who happen to have babies who have some complex conditions as well. In that role, I direct a clinic that is specifically designed for moms with substance use disorder. So we take care of women who may be battling addiction from opioids, marijuana, cocaine, you name it. And I also help direct the service in the hospital that is directly designed to take care of pregnant women. So that would be the Antepartum service that you mentioned. So any mom that's pregnant that gets admitted to the hospital would fall underneath that umbrella.
Got you. So
Yeah.
again, just so everybody know, we talking with an expert right now. So we can just kind of jump right into it. Up first with our questions here is, why is this topic so important more than ever?
Yeah. Well, over the last 15, 20 years, we've seen a market increase in bad outcomes for pregnant women, particularly Black and Brown women. We've seen an increase also in maternal death, and that is highlighted in Black and Brown communities. And then we had COVID, which came and sort of amplified all of those concerns that we've had about poor outcomes and maternal death. Some of the data suggests that COVID increased the mortality rates by 40%, particularly in the Black and Brown communities. So not only has this been a problem for a little bit, it's been an even greater problem because COVID highlighted a lot of the deficiencies that we have in providing care for these communities. And so in my role as a high-risk OB provider, these are all things that really come across my desk. And I see patients who may be at the highest risk of having poor outcomes, and even in some cases, risk for death.
So that's definitely extremely serious and heavy. Just backtracking a little bit, what specifically about COVID kind of made things like this?
Well, COVID really put everybody in almost a lockdown. People were afraid to even leave their houses. That in some cases meant that patients didn't make it to their appointments. We also transitioned a lot of visits to telehealth visits. And so that meant that some patients were engaging in the healthcare system, not necessarily directly in person, but over the phone or via video. And when people were in quarantine, people even lost their jobs. And so we were changing in some ways in which patients were engaging with the healthcare system. You also had patients on the other hand, in some cases, losing some of their resources. So that meant increased rates of unemployment, increased rates of housing instability, increased rates of food insecurity. And when you take those social determinants already in a very difficult position, it further exacerbates the issues that we have regarding the care of Black and Brown communities.
Yeah. Basically, every time at least personally for me, thinking about the last couple of years, as a father, these kids and these young mothers and everybody are having to deal with life in a completely different way. And it was like, it was kind of overnight. So it's always interesting to hear the results of some of this that we weren't perhaps thinking about back then when we were just trying to get through the day. So yeah, I definitely understand your explanation about that. Why are women of color in particular at increased risk?
Well, the answer to that is multifactorial. There's systemic racism. There is implicit bias on behalf of providers. And there is a general sense that the way in which the healthcare system is potentially set up is not necessarily designed to engage people who may be from Black and Brown communities. For example, you take a young African-American male who might be dressed in a hoodie and sweatpants, walks in the hospital. The provider may already have preconceived notions about that young African-American male compared to a young Caucasian male who might be dressed in shorts and t-shirt. And those preconceived notions that we have about people impacts how we communicate with them, impacts whether or not they're able to establish rapport with us, impacts whether or not they walk away from our engagement feeling judged or feeling welcomed. And in some cases can impact the physician's thought process about the patient's medical care. So that's one thing.
Right. One big thing.
One big thing.
Yeah.
And sometimes our healthcare systems aren't necessarily designed to address some of the social determinants that I mentioned earlier. Luckily, we're at MetroHealth. And so MetroHealth is committed to addressing those social determinants. But in some cases, if a patient misses a couple of appointments, and if they're in a healthcare system where nobody stops to ask, Miss Thomas or Miss Johnson, notice you missed a couple of visits, what's going on? How can we help you? Then that means that patient can go months without being seen. So that's just one example.
Yeah.
And there is also, because of those historical issues regarding racism and lack of addressing social determinants, patients can develop mistrust. And that, along with the other issues that we're dealing with, can further sort of increase the difficulty with caring for that patient population.
You touched on a lot there. And these interviews typically aren't an hour, so I won't hit every single thing that just popped into my mind. But I will say that I found it interesting that, one of the lead things that you said was the systemic racism that, we all know has plagued a lot of different aspects of life in this country over the years. And that's this really scary thought, because I'm a father of two daughters, and they both teenagers. And knocking on wood, we don't ever have to. I mean, not never, but no time soon we have to have any types of conversations about, just worrying about how they are proceeding with their doctor care if they ever come to be expecting. But for those people who are watching this, who might have a young daughter who is pregnant, or any situation that would revolve around this, what advice can we give them to look out for the patient, to keep them on the right track, but also to make them comfortable in knowing that they are receiving the best care that they can get?
Well, I would say trust your own instincts, trust your voice. If something doesn't seem right, just keep speaking up about how you feel and what's not going right with your body. You do know your body better than anybody else. Yeah. I'd also encourage young women to rely on their villages. That's mom, grandma, girlfriends, sisters, cousins, aunts. Rely on people who have gone through pregnancy or gone through complex medical conditions, who you can bounce ideas or thoughts off of, but who also can be there with you and advocate for you. We also have a lot of great community agencies that are willing to also fill in the gaps there, particularly a lot of the doula services that are within the community. Birthing Beautiful is one that Birthing Beautiful Communities is one that comes to mind, and it's full of strong, well-informed birth workers who can be there to support and to also advocate. But, I tell people it takes a village, no matter who you are, no matter where you come from, and no matter what you're facing. And particularly when it comes to Black and Brown communities, rally the village.
For sure. The one thing that of course it escapes me now, but I'm going to circle back to that as soon as it pops back up, because there's one thing that you said that really stood out to me that I wanted to address. But while I jog my memory, I will remind our audience and our viewers that are watching right now, I meant to say this at the beginning. If you're watching this, if you feel like there's somebody in your village, in your circle that needs to get this information, please feel free to share them this video. It doesn't disappear. Y'all know how social media works. It's going to live forever. So please pass this along to them. Always great conversations that we have and receive very vital information from the different reps at MetroHealth. So we'll close out with this. What of all the things that you said that are ongoing issues in any hospital in any part of the country, what is MetroHealth specifically doing to counteract some of those conceptions and just realities that we have to deal with?
No, I'm glad you asked that. I feel that MetroHealth has really been on the front lines of this work, and that it's being approached in many different ways. It's being approached from addressing implicit bias and ensuring that all faculty members have training on that, even ensuring that our trainees, our residents and our fellows undergo educational sessions about implicit bias, how to recognize it, how to prevent it, and how to prevent it from negatively impacting our patients. We have an Office of Inclusion, Diversity, and Equity that is currently working on programming for the entire community and county, making sure that patients are aware of our efforts, also programming that's going out into the communities and getting the voices of patients so that they are heard and that we understand what specific things that we need to work on as a healthcare system. In addition, we are actively addressing social determinants of health in many ways. MetroHealth, many of the departments have resources to assist patients with transportation, resources to assist patients with food insecurities, as well as resources to assist patients with housing insecurities. Specifically, the OBGYN department is supporting a sober living house or sober living facility that's specifically designed for women with substance use disorder and housing insecurity. So we're looking at all of the various ways in which there may be barriers to engaging with our healthcare system and coming up with solutions that are patient-driven and data-driven.
I've now spoken, I think, with about maybe 10, maybe a dozen of the different doctors and reps over at Metro since we started this. And I say this a lot, but I say it a lot because it's true. I literally learn more every time I talk to one of you in our short conversations. So again, if you're looking for more information from Metro, they gave me the phone number here. It's 216-778. If you would like to schedule an appointment, 216-778-4444. And then for more information, the website is metrohealth.org/obgyn/pregnancy-care. Of course, we're talking about Black maternal health that is going on this week, April 11th through April 17th. And Dr. Pippen, two things before we close out. One, I've always tripped myself up, especially when I'm talking to the female doctors, going back and forth between Miss and Mrs. And then it hit me after a couple weeks ago. I was like, they're all doctors. Call them doctors, which is why I said that at the lead of today. So you are Dr. Jessica Pippen. We thank you for your time today. And I did get, the thought did come back to me that left me for that 1 second. When you said, trust your voice, like that's something as a father, I need to bring into my, you know how us dads do, us old school dads, we say the same things all the time. I need to add this to that repertoire because I know I can say a lot of things to my kids, but it really is super important to trust your own instinct and trust your voice. And that was one of the first things you said when I asked you about, you know, making sure that the young mothers are in the right hands with whoever they're meeting with, whether it's at Metro or not. So I appreciate that.
You're very welcome. Thank you for having me on.
Absolutely. Thanks for finding some time with us. You guys are always so great. This was another episode of Wellbeing Wednesday with Matty Willz, brought to you by MetroHealth. We will see y'all soon. Thanks.